Feeling like your back's in constant knots from sitting all day? Or maybe your upper back here just won't quit nagging? If that sounds familiar, you're in the right place. Today, I'm going to show you some quick and effective stretches that you can do to unlock the tension and improve your mobility and finally give your mid-back the relief that it's been begging for. So let's dive into it. Stretching is often overlooked, but crucial for maintaining flexibility and relieving muscle tension. For those of you suffering from back pain, especially mid or upper back pain, it can help reduce stiffness and improve your range of motion. Stretching plays a crucial role in maintaining the health of your spinal joints and alleviating tight muscles. Here's how it works. It improves joint mobility. By increasing the range of motion, and stretching helps maintain or improve the range of motion in the spinal joints by gently moving them through their full ranges of motion. This prevents stiffness, reduces joint restrictions, and enhances flexibility. It reduces joint pressure. By promoting balanced movement and flexibility, stretching reduces pressure on the spinal disc and facet joints, which can decrease wear and tear, which leads to degeneration issues like arthritis or disc herniations. It relieves muscle tension by lengthening the tight muscles, elongating these shortened muscles around the spine, which often become contracted due to poor posture or prolonged sitting. It helps to relieve this tension and prevents muscle imbalances. It promotes relaxation and encourages blood flow to the area, and the muscles helps to flush out lactic acids and metabolic waste products that contribute to muscle stiffness, soreness, and fatigue. It enhances blood flow and nutrient delivery, boosts circulation. Stretching increases blood flow to the spine and surrounding muscles, delivering oxygen and nutrients that aid in muscle recovery and joint health. The discs in your spine don't regularly get a lot of blood flow. Movement helps increase nutrients coming into the disc and helps with waste products coming out of the disc. It promotes healing, improves circulation with tissue repair and recovery, reducing the risk of chronic pain and injury in the spinal joints and muscles. It reduces the risk of injury, prepares muscles for movement. You can't look at a sports game on TV without them doing stretches before the game starts. Stretching before physical activity warms up the muscles and joints, reducing the likelihood of injury from sudden or intense movement. It helps correct posture imbalances. Regular stretching helps maintain the correct alignment of the spine by balancing forces exerting by tight and weakened muscles, which can prevent stress-related injuries. Essential stretching for the mid-back and upper back. Let's get started with some essential stretches to target those tight muscles. I'll walk you through it, each one, and I'll explain how it works. First, hanging from a pull-up bar. This stretch is excellent for decompressing the spine and relieving tension in the mid-back. Hanging from the bar lets gravity pull your body down. Hold this stretch for 20 to 30 seconds. Repeat 2 to 3 times. Next is child's pose. Kneel on the floor, extend your arms forward. Child's pose is a fantastic stretch for both your lower and mid-back. It gently stretches the spine while encouraging relaxation. Hold this for 30 seconds, focusing on deep, slow breaths. Rhomboid stretching. The rhomboids are located between your shoulder blades. Often get tight, especially if you're doing work at a desk. This simple stretch helps loosen them up. Hold for 15 to 20 seconds per side and just feel the tension release. Hyperextension stretch in a chair. Lean back in a chair. Put your hands behind your neck. If you sit a lot, this stretch is great. It opens the chest, stretches the thoracic spine. Lean back gently over the back of the chair. Hold for 20 seconds. Neck range of motion stretching with overpressure. The neck and upper back are closely connected. Gently guide your head from side to side, back and forward, holding each stretch for 15 to 20 seconds. I like to do flexion extension that's forward and back, rotating, which are back and forth, like you're saying no, and then side to side movements. Next, the cat-cow stretch. For this stretch, you'll be on your hands and knees. This is a great dynamic stretch for your entire spine. Moving between flexion and extension helps relieve tension in both the mid and upper back. And last but not least, thread the needle. This is also done on the floor, on fours, hands and knees, threading one arm under the other. This stretch targets the shoulders and upper back. It's fantastic for releasing tightness and improving mobility in the thoracic spine. Now, additional tools for even more relief. Now let's talk about two simple tools you can use to even get more out of your stretches. One is the foam roller. For the thoracic spine, the foam roller is excellent. The foam roller is great for self-myofascial release or self-massage. Gently roll up and down, gliding, going back and forth, pausing in tight spots. This helps release muscle knots, improves spinal flexibility. Next, we have an inflatable therapy ball. We use this in the thoracic spine, that's between the shoulders. We're going to put it against the wall. We're going to extend backward over it in the area that's tight. This therapy ball is perfect for promoting thoracic extension. Gently lean back, open up the thoracic spine, hold each stretch for 20 seconds. Stretching is key to relieving tension. But to get long-term relief, you need to strengthen the muscles that support your posture. In the next video, we'll dive into strengthening exercises that complement these stretches. All the products we used in this video today are listed in the description below. They are affiliate links, which means I may receive a small commission from the sale of the products. Check out the next video on strengthening for mid-back and upper back pain. That's it for today. Hope you enjoyed the video.